So South Africa has a highly unequal healthcare system. The public sector is underfunded, while most South Africans can't afford the exorbitant cost of a private care. So Russell Rensburg is the director of the Rural Health Advocacy Project, which champions equitable access to quality healthcare for the country's rural communities. He shares with us tonight how those gaps can be plugged. Mr. Rensburg, thank you very much for joining us this evening. Thanks indeed for your time. So let's start with, did the medium-term budget speak to addressing some of these challenges facing South Africa's healthcare system at all?
Well, in my view, no. Right? I think, with most things, we always have to start with the problem we're trying to solve.
Yeah.
And I think that there is actually very little consideration of the conditions of the South African health system or the health of South Africans in the way that the budget was put together. And I think I make that argument in my conversation piece.
Yeah, but budgets don't necessarily solve some of these structural issues. Talk to us a bit about that and what can be done to address those.
Look, I think you have to start with, what is it that we want to do? So this budget was really just about fiscal consolidation, management of the debt, and sort of keeping things the same. And I think one of the mistakes that we're making is that on the one side, health, for instance, is a very people-driven business. We've just come out of two or three waves with possibly a fourth wave.
Yeah.
Wave coming up for COVID. Our health workers are exhausted. And I think the government's response is to say, no, we're just going to unilaterally freeze public sector wages. And that's the wages of managers, administrators, porters, doctors, nurses, everybody. So I think on the one side, while we're trying to achieve this wishful thinking around a primary surplus, we're actually doing more damage to the system. Right? Because we're not investing in the kind of things that we need to invest in. And I think in the paper, what I do is there's some research that came out recently that really just evaluated South Africa's response to the Sustainable Development Goal 3, which is around the achievement of UHC. Yeah. Right? And the researchers used existing South African data, and they basically looked at 4 broad categories of health. And these include things like reproductive and maternal child health. They include things like infectious diseases, HIV, TB, COVID. And then non-communicable diseases, which we were found really wanting going into this pandemic, given the amount of people living with diabetes in South Africa, but not on treatment. So it looks at non-communicable diseases. And then lastly, it looked at sort of health system responsiveness. Do we have enough doctors? Do we have enough nurses? Do we have all of those? Is the health system responsive? And when they looked at those targets across almost a 10-year period between 2008 and 2017, it found on average we were probably just over 50% coverage on most of the major diseases. And then when you start considering the COVID interruptions, the health of South Africans is in a very poor state. Yeah. And the health system is very poorly set up to be able to respond to that.
Yeah. Did it even speak to, for example, how government plans to mitigate the impact of COVID-19 on the health system? Because that certainly should have been something to look at, given the fact that we believe that we're on the cusp of this 4th wave.
Yeah, in my view, I feel like we're actually penny wise and pound foolish. So health is a competence that's shared between national and provincial governments, where provincial governments are the implementing agents. And in order to implement or to deliver on their health targets every year, they rely on funding that is transferred from national, which is through the provincial equitable share. Now, that equitable share funds a lot of the social wages that the minister talks about, which is delivery of education, cooperative governance, and most importantly, health. And over the next 2 to 3 years, they're actually cutting that budget. Right? So when we should be investing or really reconsidering our investments, we are actually taking away the lifeblood of that engine. And I think I would have rather gone back and said, listen, what is the health management information systems telling us? Yeah. Where are the areas that we need to invest? How can we take this budget envelope that we have at the moment, which is around 264 billion for the public sector, and utilize it to actually address the issues within the health system? So let's start with the problem that we need to solve, which for me is about expanding access to primary health care, particularly in underserved areas, and then see how we can use the government budget to actually advance that goal. You know, a lot of the investments that we made over the last 18 months or so have been mostly at the hospital level. You know, as we look to respond to COVID cases and the like.
And I guess,
and even then,
and I guess, Mr. Rensburg, it would be the rural communities themselves that would be caught mostly on the back foot due to access to quality healthcare.
Absolutely. You know, health is not just determined in the health system. You know, health is also socially determined. And our rural communities, particularly those in the former homelands, are amongst the poorest. You know, work opportunities are the scarcest. You know, youth unemployment or unemployment in a lot of our former Bantustans or rural areas is up to 90%. You know, so the public health sector is probably the only health access that people can get. You know, and when that is weak, you know, unfortunately, a lot of the resources get sucked up in the big cities with all the big hospital complexes and the like. And the further you move out of the city, the less available health becomes. And when you start constraining budgets, you know, it starts at the center before it pushes out. So the impact will be most felt on the rural health system where access to healthcare is the most needed. And I think that's one of the areas where the Treasury didn't really consider the constitutional obligation of everyone's right to access healthcare services. And that rural communities, unfortunately, get discriminated, not just on their income level, but also on their location.
All right, Russell Rensburg, thank you very much for joining us here on the programme. Director of the Rural Health Advocacy Project. Thanks indeed for making time to speak to us.